Well, thank you, Mr. Chairman, and thank you to all of our witnesses today for your testimony. I've appreciated it, and I think that your prepared testimony and your answers to the questions today have been really helpful on this important topic. This has long been an area of bipartisan agreement, and I do hope we can move forward on some of the thoughtful recommendations and ideas that we have heard, not only today, but over the last several years about this issue. But once again, I caution everyone on this committee and everyone participating that these are not normal times, and we can't pretend that they are. To the extent that holding this hearing suggests that they are, we have to acknowledge that they are not. Like my colleagues who've spoken before me, I can think of more than a dozen topics that this subcommittee should be holding a hearing on about unprecedented and tremendously damaging recent actions in the Trump administration, like the announcement that the Secretary of Health and Human Services just fired all of the members of the Advisory Committee on Immunization Policies, or the staff reductions and delayed and canceled research at the National Institutes of Health, or pauses in funding for grants at institutions that do critical medical research, undoing decades and decades of work that this country has invested in to lead the world in medical research and in scientific research more broadly. These are just not normal times. And these are huge issues in my district, where so many people work at the Texas Medical Center, the largest medical complex in the world, doing the groundbreaking research that we are talking about in this country, including development for new vaccines for diseases threatening people here at home and around the world. So I appreciate the importance of making our healthcare supply chains more resilient, but we cannot have this conversation without acknowledging that the Trump administration is today taking steps to gut our federal agencies that are directly responsible for making these supply chains function properly and result in safe and effective medical products for Americans. It was only 2 months ago that HHS fired 10,000 workers across the agency, including 3,500 at the FDA. The mass layoffs were done so haphazardly, as many of us in the room know, that the FDA had to hire some of those people back because they were critical to food and drug safety and work at the agency. Another example, firing all 13 of the Division of Policy Development staffers in the Office of Generic Drug Policy at FDA. This team drafts, reviews, approves the policy guidance that we're talking about, give instructions on how generic versions of branded medicines can be developed and brought to the market, the kinds of things we're talking about today. The administration is gutting these agencies that do absolutely critical work. And so, I'm glad that the administration realized its mistake and that some of these FDA employees have been rehired, but it's another example of a shoot first and ask questions later approach that is a huge threat to our healthcare supply chain. So, for months, guidance documents outlining the approval of pathways for generic drugs were put on pause. Mr. Murphy, I know that your agency or your organization put out a press release expressing concern about this in early April about the staffing cuts at FDA. Can you share with us how has the confusion from the firing and rehiring of this team and the subsequent delays in issuing new guidance impacted generic drug development and approvals?
Yeah, thank you, Ms. Fletcher, for the question. As you noted, obviously, we view FDA as a very critical component of the drug supply chain, both in ensuring safety and making sure patients understand what they're getting is effective. We did see a number of delays this year that thwarted the ability of manufacturers to request product-specific guidance. It does appear that that is starting to come back online, and I think we were very heartened to hear that the agency is starting to look at the Office of Generic Drugs to rehire individuals, because it's a component of the agency that I think could benefit from more capacity versus less capacity. And so, we were glad to see Commissioner McCary announce that they were going to bring those folks back in the Office of Generic Drug Policy. But we now have a backlog that we have to work through, and from a generic drug standpoint, that inhibits the ability to bring more affordable medicines to patients sooner. So we hope and we look forward to working with the agency to try and address that backlog.
Well, thank you, Mr. Murphy. And I just want to reiterate, it doesn't have to be this way. It doesn't have to work this way. This is an approach the administration has chosen, and there are other things the administration has chosen to do that I'm going to submit a question for the record to you, Mr. Bolin, because another thing that this administration has chosen to do is impose tariffs on all kinds of imports. We've talked about it a little bit earlier, but I want to ask you, and we'll submit for the record, a question about how those tariffs are impacting pharmacies. I'm hearing and seeing reports particularly that tariffs on pharmaceuticals might impact pharmacies, and I know that that's a concern certainly for our chairman and for all of us for access to drugs for our constituents. So I thank you all very much for your work and for your time today, and I thank you, Mr. Chairman, for letting me go over just a minute, and I will yield back.